Hi, hello. A very good afternoon to everyone. My name is Wing Lam, and I'm a community pharmacist working in Watsons. On this Facebook segment, Ask Our Pharmacist, I'm here to discuss about a health topic that was voted upon by you when we released the poll on the Watsons page last Sunday. So the topic with the most votes was sinus. If you have any questions due along the way, feel free to leave them as comments below. So with the COVID-19 pandemic occurring, many people are very fearful of having cold or flu-like symptoms. If you would like to know more about COVID-19 symptoms, you can use the sgcovidcheck.gov.sg website. However, there are other conditions that present with similar symptoms like runny or blocked nose. So let's talk about those today and let's see how we can manage those conditions better to avoid those symptoms in the current situation. So let's start with what is sinus actually. So when people mention that they have sinus, they may be referring to having a sneezing or having itchy or runny or blocked nose. So you may see the terms rhinitis and sinusitis being used. Rhinitis means that only the nose passages are affected, and sinusitis means that the sinus cavities, which are air-filled cavities within the bony structures of the cheeks, behind the forehead, on the eyebrow, on either side of the nose bridge, and behind the nose, are also affected. So today, let's talk about runny and blocked nose in terms of rhinitis, which means at the nose passages itself. It can be acute, meaning lasting less than 6 weeks, or chronic, which means lasting more than 6 weeks. So for acute rhinitis, it can be due to the common cold or other infections. So for chronic, let's break it down to allergic and then non-allergic conditions. So let's start with allergic rhinitis first. Some people may actually refer to allergic rhinitis as sensitive nose or hay fever. So this is because the body's immune system reacts to a perceived threat called an allergen. So examples include plant pollen, mold, dust mite, animal dander, or fur, chemicals, or food. So many people are cleaning their houses more frequently nowadays, and they may find that they get itchy, sneezing, runny or blocked nose when they are in contact with dusty surfaces or when they smell the cleaning chemicals. So usually in this case, right, usually the discharge from the nose is clear and with no fever. So some people may have itchy throat or cough due to what we call the post-nasal drip, meaning that we had the runny nose, then the mucus drips to the back of the throat, tickling the throat and causing the cough. So it might disturb their sleep because the post-nasal drip occurs more when they lie down. So when you lie down, the mucus will drip to the back. So some people may also have itchy, red and watery eyes due to exposure to these allergens. Actually, allergic rhinitis affects about 13.1% of Singapore's population and can actually be diagnosed by a skin test or a blood test. However, some people do not manage to find out what they are allergic to from these tests as they are not allergic to the samples that are actually used for the test. Hence, it is good to actually keep a diary of your symptoms. For example, what you were exposed to or what activities you were doing before or when these symptoms occurred. This can give more clues on the potential trigger. If you have identified the allergens, then try to avoid them if possible. So, for example, if you found that dust or animal dander or fur is a trigger for you, then vacuum your house to keep it clean and to reduce allergies. Or, if possible, wear a mask when vacuuming or cleaning to avoid breathing in the dust. If mold is a trigger for you, you can consider to use an air purifier with high efficiency filter, what we call the HEPA filter, to control the quality of the air or to reduce the humidity and ensure good ventilation of your house to prevent mold formation. Other suggestions include washing your bed sheets weekly or using an allergen-proof sheets for your pillows and your mattresses. If you have pets at home, if possible, try to keep them off your bedroom and off the furniture. So that's allergic rhinitis. So what about non-allergic rhinitis? If non-allergic rhinitis, right, the symptoms are actually pretty similar to allergic rhinitis, but it's caused by changes in temperature or when you breathe in smoke. So you might find that I have sneezing or itchy runny nose when we walk past the smoking zone or when you enter or exit air conditioned areas like shopping malls or office. So that would be for an example of the non-allergic rhinitis. For some people, spicy food may also cause the runny or blocked nose. So if that's the case, you may want to consider avoiding or minimizing spicy food or keeping away from smoking areas or smokers as much as possible. So another example of non-allergic rhinitis is that it can be caused by changes in hormone levels during pregnancy. So in this case, the symptoms usually clear once the baby is delivered. So you might wonder, so is there any medication to help to treat the runny and blocked nose? There are quite a few types of medications. So for example, the antihistamine can help to treat the itchy, runny nose and the sneezing. And there's another type of medication called the decongestant. It actually helps to reduce the blocked nose, and it comes in either the oral form or the nose spray or drops. Try not to use the decongestant nose spray or drops for more than 3 to 5 consecutive days, as it can cause the nose block to worsen after stopping the medication. So some people might find that, hey, how come this medicine doesn't work when I use it, it becomes more blocked? It might be because we actually use it for too long. That's the case of the nasal decongestant. So another type of medicine would be the steroid nasal spray. It actually decreases the swelling around the nose passages and reduce the symptoms of allergy. So this type of medicine can be used for the prevention and also the maintenance of allergic rhinitis. If let's say you are looking for a more natural option, there are non-medicated saline spray or washes that can help to rinse out the nose or sinuses and help to reduce the symptoms also. So do talk to your pharmacist or doctor to find out which option is more suitable for you and how to use them to get the best results and reduce the side effects. For example, some people mention that the spray causes a bad taste in the throat. So actually some nose sprays are meant to be used when you are leaning slightly forward, because if you lean backward, right, when you spray, it actually drips down the back of the throat and causing a bitter taste and will be absorbed more into the body instead of at the nose where it's supposed to be. So do let your pharmacist or doctor know also if you have any medication allergies, taking any medications or any medical conditions. So in light of COVID-19 currently, if let's say you have the runny or blocked nose with recent travel, close contact with COVID-19 cases, or prolonged symptoms with fever for 4 or more days and not recovering, do see your doctor and do not Dr. Hop. So COVID-19 aside, if let's say you have chronic symptoms for many weeks, or if it worsens despite using medication, or if you're having yellow or green discharge from your nose or ears, swelling around the eyes, or breathlessness, do see a doctor for further assessment also. So let's see if we have any questions. All right, we have one question from Yan Hong. Yan Hong is asking, do people grow out of having sinus? Hmm, it will depend on the cause of the sinus. Let's say, for example, let's say it's due to the allergic rhinitis. So over time, they might find that they manage to find out what is the trigger and to help to and learn to avoid it. So in this case, they end up feeling less of the symptoms. As to whether they got tolerance over to to the allergen itself, that one it really depends on individuals. Like let's say for example, asthma. Asthma is also a subtype of allergic atopic condition. Some children do grow out of it, but for some people it just persists into adulthood. So unfortunately, it really depends on the individual, but it is possible. So there is another question that some people may be thinking about. They may be wondering about how to boost the immune system. does it help to reduce the sinus symptoms? So if let's say the sinus is due to the cold or flu, then boosting the immune system can help to reduce that. So if possible, try to have a healthy diet with fruits and vegetables. More people are cooking at home nowadays, so hopefully that helps us control what we eat better. If possible, try to get sufficient sleep and exercise, drink enough water, and reduce stress, and don't smoke. So wash your hands thoroughly and frequently, which I'm sure we are all very familiar with by now, and keep a safe distance from others who are ill. And to reduce the chances of catching influenza, you can actually consider to get annual flu vaccination. It takes effect in about 2 weeks, and this can protect you and also the people around you. So some people have shared with me that they were wondering whether stress or lack of sleep can it lead to sinus symptoms. So stress and lack of sleep may actually affect your immune system, which can increase the chances of getting a cold and flu, which can actually cause sinus symptoms like, let's say, the runny nose, blocked nose, sneezing. So let's see if there's any other questions. There is a question from Colin as to whether there's any supplements that help to reduce the sinus symptoms. In this, if let's say the sinus symptoms are due to the common cold or flu, people have used supplements like the vitamin C or zinc. However, the evidence is actually quite variable, and there's no very strong evidence to show that it helps to prevent a cold or flu. For some people, it helps to speed up recovery after getting the cold, and also another option is some people have tried echinacea to reduce the chances of getting a cold, but again, the evidence is not very strong. Other options include the elderberry or also the pelargonium. It can actually help to reduce the symptoms of the flu also. But of course, the effects varies amongst individuals. And do note that before taking any supplements, do consult with your doctor or pharmacist first, especially if you have any medical conditions or you are taking any chronic medications, because there might be some interactions with the supplements. So it's good to check first. So let's take a look. Some people may also be wondering about because previously we mentioned about the let me see, there's a question from Mariam as to is it safe to use the steroid nasal sprays long term. There As a pharmacist, we do encounter queries and concerns about steroid nasal sprays because the word steroid it causes discomfort in some people. They are concerned about the side effects, especially for long-term use. So let's talk about the side effects of steroid nasal sprays first. It is There are some common side effects would be the discomfort or irritation in the nose, and they are usually temporary. And actually, some side effects can be reduced if you use the proper technique. For example, right, if let's say you insert the nose spray and you spray straight up, you'll find that it's quite stinging at the top of the nose. So usually what we suggest is after you insert the nozzle, try to point it a little bit to the outside before you spray. That will actually help to reduce the stinging when the spray hits the sensitive tissues at the top of the nose. And try not to point towards the middle because that will affect the what we call the nasal septum. It is the middle part of the nose. So after we insert, remember to point a little bit to the outside before you spray. And then there are concerns about the steroid causing the side effects in the other parts of the body. So again, this can actually be reduced if you use the proper technique of the nasal spray. So as mentioned earlier, some people mentioned that they actually have the bitter taste at the back of the throat when they use the nasal spray. It means that actually the nasal spray went to the back of the throat and is being swallowed. So it will go to the rest of the body and will cause side effects elsewhere. So if usually you'll suggest when you spray, try to lean forward and breathe in lightly, not too much. Because if you lean back or you breathe in too strongly, then actually the medicine all goes to the back of the throat, it gets swallowed, then it goes to the rest of the body where it's not intended to, then it may actually cause more side effects. So if you use the proper technique, then actually the medicine will stay in the nose where it's supposed to be. It will work where it's supposed to be and not go to other places where it's not supposed to be. That's the idea of it. So, okay, so that was our last question because due to times. And thank you everyone. And that's the end of today's session. Hope that this is helpful for all of you. You can continue to leave any queries on sinus in the comments. So do look out for the next poll and see you next time. Stay healthy, have a good weekend, and to all our Muslim viewers, Selamat Hari Raya.